Until fairly recently, the treatment options for patients with persistent or resistant forms of atrial fibrillation have been very limited. This is because the medications that are available or ablation techniques in the electrophysiology lab that have been available to treat lighter forms of atrial fibrillation or more treatable forms really did not work for patients who have continuous forms of atrial fibrillation. And usually these patients are treated with what is called a rate control strategy, which is lowering the heart rate to something that is comfortable, and also anticoagulating the patients with blood thinners to prevent stroke. A very new innovation for the treatment of persistent atrial fibrillation has been brewing over the past few years, and I have been involved in developing this procedure, which is done in the electrophysiology lab and is a treatment strategy that is directed at two parts of the left atrium heart chamber that are both very important in persistent forms of atrial fibrillation, namely the pulmonary veins as well as the back wall of the left atrium itself. These can both be treated with ablation strategies in a combined fashion with a surgeon as well as an electrophysiologist in a minimally invasive procedure in the electrophysiology lab, not an operating room, and we have been seeing success rates for these patients in the 90% range, which is both very surprising and very pleasing.